All right. How you guys doing? I know it's a beautiful afternoon. We're going to have some fun here. We're going to learn some about residencies. I'm going to go over some just original information regarding what residency fellowships are, kind of go over some of the standards, because I'm on the standards committee of some of the requirements for fellowships and residencies. I have Joe Hallock here. I'll have him introduce himself in a second, who is currently our UND sports resident. So it's nice sometimes to ask questions, not only of me, but of the actual residents themselves, to kind of get a feel for, what they did to get accepted and how they built their resume and things like that, and what things to look for. So Joe is gracious enough to rip himself away from this wedding that he's at, right? And share his expertise. So appreciate that. What I'm going to do is I'm just going to see if I can share my screen. I had it before, but now it's going to, I'm sure, do something that I don't want it to do. So it's the way it's been going. All right. Okay, so hopefully right now, hopefully you're seeing the ins and outs of PT residencies, right? To apply or not apply. Perfect. All right, like I said, I'm Gary Schindler. I'm an associate professor here at University of North Dakota. Been here for about 7 years. Graduated with an athletic training degree in '99. Went to lacrosse, got a PT degree. Came back 7 years ago. I've been teaching. I currently work also at Achieve Physical Therapy, about 10 to 15 hours a week, and I'm the program director of the UND Sports Physical Therapy Residency. Like I said, we have Joe here with us. Joe, would you mind just kind of introducing yourself and letting them know who you are and what you do?
Yep. So my name is Joe Hallock. I went to PT school out at UMary. Went to undergrad at Concordia from Fargo, and so yeah, I just started the program this year, and due to COVID, obviously things are a little different, but so far it's been great working with Gary and Kathy and Jake over there at UND. It's been a lot of fun.
All right, so the rules are to this is I'm going to go over a few slides, but anytime you have a question, I would ask you to just speak it, right? You can put it in the chat. A lot of times it's hard to see the chat. I'm sure I'm sick of Zoom. You're sick of Zoom. Everybody in this world probably sick of Zoom by now. So just go ahead, be confident, ask the question. It'll be a good question, and we'll get the feedback right away, and we'll keep rolling with it. All right. So first of all, I want to make sure that this works, right? So you'll have some options here. You should see who is your favorite 80s rock band. All right. So what I want you to do is I want you to text to the number 37607, and in the message line type Gary Schindler without the R 955, and that'll join you to this session. So text to 37607, type in my name without the R 955. Then whenever you get in, it should let you know you are joining Gary Schindler's session. And then if you could answer this question. I have my answer. My answer is correct. I'm sorry. But we'll see what you say. Oh, we got some other there. It might tell you that there's a charge for when you hit the send. I ignore it, hit send. I've never been charged yet, so we should be good. If so, I'm sorry. Okay, did anybody get a chance to answer? Did anybody answer anything? One of the ones that aren't marked here? And we're not recording you? Nobody picked Def Leppard or Poison? I almost picked Poison. I'm kind of a closet Poison fan, but all right. Correct answer is AC/DC, of course, right? So has to be AC/DC. All right, so the objectives of this presentation. I want you to be familiar with the different types of residencies that are available to you, okay? I want you to be able to see how many numbers there are, how many people have graduated. I also want you to understand the standards that kind of go with residencies in general. all residencies have similar standards, and then depending on what residency you want to go into, they might have some nuances with it, like the sports one. With sports, you need 200 hours of event coverage, right? So there's some nuances with some of these residencies, right? I also want to discuss what are some of the pros of residencies, what are some of the cons, okay? And then how in the world can you put yourself in the best position when you apply to get accepted? Okay, now I'm biased. I believe that if you can get to a residency, do it. It's only going to further your education. It's going to further your development. And it's going to put you like steps ahead of your peers at this point. So I'm a big advocate of it. Do I think every single PT student should come out of school and go to residency? No. But I do think there's significant benefits to it. And we're going to hit some of those today. And then we're going to try to just help you decide if it's for you or not. Okay. So as we go forward, I want to know if you're planning on applying for a residency position. So go ahead and type that in. Okay, so it looks like none of you are hardcore yeses. All right, and again, if you guys have any questions, just shoot them at me. Okay, one of you said mine isn't working, but yes. All right, perfect. That's fine. So can I ask you what type of residencies you guys are considering? And Alex, if you want to just, if yours isn't working, if you want to just shout out at me through chat. Okay, pediatric.
Gary?
Yep.
Just to clarify, residency is the same thing as clinicals, correct? When you...
Residencies are once you're a licensed physical therapist, you can then apply to be accepted into a residency. So you're already a licensed physical therapist and you get one-on-one training for a certain amount of time. Okay? So once you get out of PT school, you pass your boards, you can decide to then go into a residency. And there's multiple different residencies, which we'll talk about. And what that is you'll go through pretty specific training in a certain area. Like for us, we're sports. So the licensed therapist will then be inundated with sports related research, be able to treat athletes, right? One-on-one mentoring of sports medicine. If you do a pediatrics, then you'll be with children, right? And get that focus on pediatrics itself. But it's when you're a licensed PT and you want further development, further education, further training.
Okay,
Yep.
thank you.
You bet. Sorry about that. I should have said it right off the bat. So we have some ortho, uninsured, geriatrics, neurology, geriatric. Perfect. So a couple of geriatrics in there. All right. That's good. So currently, and you can go on different websites and you can go on to AP. There's a American Board of Physical Therapy Residency and Fellowship Education websites. And I'll show that next slide that you can get all this information from. So this is basically identifying the different types of residencies there are. So on the top left, you can see that there's 347 residency programs. So the past 20 years has been 5,470 graduates from residencies. Okay? The lists you see are the different types of residencies that are available. The ones in red are the ones that once you finish that residency, you can then sit and take the specialization exam and become a clinical specialist in that area. Okay, so it's really growing. Since last year I did this presentation, there's probably been about 200 to 300 more residency that kind of, or not, people that graduated since last year, about 500, I suppose, and the programs continue to develop. So we have developing programs in sports, those applying for credentials, probably about 50 to 75 programs. And so it just continues to grow. So I wanted to bring this to you so you know what options you have and what are available and which ones you actually can become a specialist in when you're done. Okay. So here are those links. You have your American Board of Physical Therapy Specialists, and that's where you can go if you want to get information about how you take the exam, when the exam is offered. And then the bottom one, AbTree, is where you'll go to look at and see what different programs are available. So if you're interested in geriatrics, you can then click on the geriatrics. You can see all the different accredited programs, and then you can sit there and you can start to isolate and decide which programs are you interested in applying to. Okay, so these websites are very important. They'll be very informative. So if you have time, go ahead and take a look at those websites. The bottom link, okay, so if you have your phone, you can take a picture of this if you want, but this bottom link is actually, they have research and they keep research of the examination passing rates, okay? So when you take these specialist exams in your different area, they'll write down and they'll calculate what the pass rating for those who were not in a residency compared to those who were in a residency. And you'll be surprised when you look at that stats, how usually if you go through residency, about 10 to 15% higher chance of passing that specialist exam. Okay, so it really adds, okay, to your ability to pass that exam at the end. Okay, and I'm going to tell you about the importance of that in a minute. But there are certain standards that go with residencies. Okay, so the program length can be anywhere from 10 to 60 months. Ours at UND is 12 months. The program hours have to be 1,800 at least, and that's broken up into 1,500 patient care hours and 300 educational hours, or we call that didactic information. So that's independent studies, journal clubs, rounds with the doctors, surgery observation, cadaver lab dissection, you know, anything that's furthering your education didactically, one-on-one instruction, things like that. So you need 300 hours accumulated in that area. The difference with sports is now you have 200 hours of event coverage, okay, that's included with that 1,500. So you need a program hours of 1,800 hours. So you look at that and you think 1,800 hours, it's quite a bit. Yes, it is. If you treat patients 8 hours a day, right, for 50 weeks out of the year, that's 2,000 hours. Okay, so this is about 1,800 hours. Now on top of that, you have research you got to complete, and you have this other didactic components you have to complete as well. So it's time consuming. So with residencies, you have to look at spending probably anywhere from 50 to 60 hours a week, some even more, in a residency. So it does take time, right? So it's not your normal 40 hours a week, clock in at 7:45, end at 5:15, right? There's extra time you have to contribute and include into your daily hours to successfully complete a residency. Some other bare minimum standards, again, are going to be your mentoring. You need 150 mentoring hours, right? And that 100 of those, the resident has to be the actual primary caregiver. Okay, so, and 100 of those have to be in person. So you can do some telehealth, but only 50 can be telehealth. Okay? And then finally, the 1 written exam and 2 live patient practical exams. I don't know what a dead patient practical exam is, but it's a live patient practical exam. So those are the requirements you need through all residencies. 1,800 hours, 150 one-on-one mentoring, and you need at least 1 written exam and 2 live patient practical exams. Okay? And that's through all residencies. Every residency tweaks it a little bit. If you want to know more about our program, I can tell you how we tweak it, but that's the bare minimum that you need for the American Board of Physical Therapy Residency and Fellowship Education. All right. So my question is, when you think about residencies, okay, just kind of get a conversation started, the next slide I'm going to put up is going to talk about some of the benefits of a residency. And I want you to choose what you think is one of the benefits, the highest benefit you think it is, right? So what would you consider to be the biggest benefit to completing a residency? All right, so mentorship, and I can't agree more with you on that one, right? So what separates residencies from other types of education is that mentoring component. And that's why when we go through reaccreditation, which we just went through a month or two ago, they hold a lot of water with that mentoring, right? So we do a lot of training with mentorship to make sure that that one-on-one training is very specific and very enhanced, okay? Because we're trying to get whoever the residents are, we're trying to move them from A to D, right? But a lot of times as you're a learning clinician and you just get out of school, you got to go to B and then you got to go to C and then you finally get to D and there's bumps all along the road. But what that one-on-one mentoring is, you get to sometimes move yourself from A to D and not have to go through that painful B and C, right? And so you can get there quicker. Your clinical decision-making is going to be quicker and more accurate, okay? Your networking opportunities, depending on where you go for residencies, okay, will be valued. I know we all know this, right? It's not really what you know, it's who you know. So you get to meet other people that can enhance your career. But the mentorship is one of the biggest, if not the biggest part of residency, in my opinion, right? Now, can a residency assist you with finding a job in that specialty area? Absolutely, okay? So a couple of residents got jobs in Fargo at Power Center, okay, and they would have never gotten that job if they would have not have went through a sports residency with us, right? And so it will give you opportunities to land a certain job if you want, okay. The bigger benefit to that is that you can sit for your specialization a lot sooner, right? So some of you raise your hand if you want to go geriatric. Are you gonna sit for the geriatric specialist exam? Or the pediatrics or neuro, or do you plan on taking the exam? Exactly. So normally you're not going to go through the residency if you're not going to sit for the exam, right? So let's say you decided you don't want to take that exam, or you don't want to go through a residency. What are you going to have to do in order to be able to sit for that exam? Do you know what the requirements are for that, Alex?
Usually it's like 2,000 hours within 3 years of taking the board exam.
Yep. And so you have to build up 2,000 hours of patient care in that population, right? In order to get 2,000 hours, again, you have to treat 8 hours a day for 50 weeks a year, and that'll give you 2,000 hours, okay? But it has to be in that specialty. So with sports, there's no way you're treating that in 1 year, right? So it's going to take you probably 3 to 4 years to build up that 2,000 hour patient population. And then when you apply to sit for the exam, you got to then wait for the first 2 weeks in March. Okay, that's the only time it's offered to take that exam. So it's going to take you probably with sports, I'm guessing around 4 to 5 years after your PT graduation to sit for that exam and pass that exam. Whereas if you graduate from PT school in May, start a residency in July, you can then next year apply for it, sit for it the next year. So within 2 years, you can be a geriatric specialist or a sports specialist or an ortho specialist or a ped specialist, right? So it shaves off a lot of time in years. Plus, your efficiency in evaluation, progression is that much more enhanced because of that mentoring that you went through, okay? And so there's a lot of benefits to completing a residency. And these are some of these. Now, it's kind of funny how I added these UND athlete shots here. And I didn't even realize I added a jumper when I said you can jumpstart your career. See how that worked out so nice, right? But again, it can foster mentorship, enhance your learning, gives you networking. I have asterisks by the last two, right? Salary may increase. You may increase chance of employment. They actually completed a survey of these private practice owners, okay? And they gave this survey to hundreds of these owners. And did the salary increase with those who completed residency? And 50% of them did, right? So they had increased salary because of that residency. Did it increase their chance of employment? 70%, okay, on that survey said, yes, that's basically why they got that job, because they went through a residency. So why in the world do you think that your salary would increase, or they would increase your salary or want to hire you if you went through a residency? Or if you're a specialist? Why? Somebody, anybody. What do you think? I'm just gonna sit here until Caitlin or Rachel or some Alex, one of you, that's who I see here on my screen, says something. Why would they pay you more, and why would you have an increased chance of getting a job?
I mean, I think it's just part of the name. You're more specialized, and that's a bonus for them or less training for them.
Absolutely. So do you think you could possibly have better outcomes? Yes. So research shows that people that come through the residencies have better patient outcomes. What these private practices and hospitals too, even though they're nonprofit, they still look at some things, right? So do you think they're interested in making money? Absolutely, right? And so do you think they could possibly market your skills and your training and your education, right? So they could be like, hey, Alex Poland is our new pediatric specialist. Okay, please come see Alex. And so it's a marketing employee as well. So they're willing to pay you more salary for the time and work you put into it and for taking that exam, right? And a lot of times when you leave and you go get that after your residency, you can negotiate some of that cost as well. A lot of times those employers will actually pay for you to sit for your exam. Do you know how much it takes, how much it costs for your examination? Okay. If you're an APTA member, it's $1,300. So, I mean, it's not cheap, right? And so you can use that as a negotiating tool as well. And a lot of times they're gonna help you pay for that, because then they can turn around and they can market that. And they're not using you. It's just that helps you. That's just like when I talk to students here, I'm like, build your resume first day, get your certifications, get your CSCS, do what you can to build your resume, okay? Because it's gonna pay off later. And so residencies a lot of times pay off later, right? So it's important for you guys to try to understand it, because it's gonna help you in the future. So there may be some pains going through it, right? Anything worthwhile doing, isn't easy. But it's going to pay off in the end. So the next slide, what I want to hear from you guys is, what do you consider to be the biggest con to completing a residency? And if you're thinking about something other, put other in there, and then just let me know. Nice, all of the above. Delay loan payback. With loan payment, it's actually nice. You can actually defer your loans, student loans, for an extra year if you're in residency. All right. Very good. Thank you very much. So as you continue to add them up here and placing your choices here, there will be increased stress. All right. There cannot not be increased stress. All right. You have more on your plate to do. You have more responsibilities. There's more work. But I guarantee you guys have felt stress in PT school. Maybe you haven't. Has there anyone that not felt stress in PT school? 3 years of, right? There is increased stress. Program required tuition. Not many programs have that. That's nice. But if you go to that AbTree website and you look up your specific programs you're looking into, it'll tell you on there if there's a tuition. Yep. But a lot of programs don't have that tuition. If they want you to take extra credits of something, they may. Okay. UND doesn't. Reduced salary is another one. Yep. And relocation. They're all good cons, right? Increased work hours, you bet. Please expect that. Okay. Can it be stressful? Yes, like I talked about. And some people do require tuition. Reduced salary over the years that I've done this presentation is one of the biggest cons that people talk about. I don't want to come out of PT school with student loans, and I do not want to have a reduction in pay, which you most likely will, right? Most programs, residency programs, are probably 80% of the going salary in that area, right? So we reimburse 70 to 80% at UND of the average starting salary in this area, right? What you will get in return from that. So let's just let's just do pure numbers. So in the Grand Forks area, starting salary of a PT fresh out of school is 55 to 60,000. I'll round it up, right? So let's say we pay 70%, that's 42,000. Okay, so you're about 15 to 18,000 back, right? The amount of money you save in the health insurance from UND, that's about 7,000, right? So you're saving money there. The amount of education we put towards the resources, your education, your continuing education is about 1,500. Okay, so you don't have to worry about continuing education after that. Okay, another 1,500. So at the end of the day, if you crunch the numbers, with any given residency, you're probably going to be what you would consider losing money, probably 10,000, around that 10,000. I just average it out, $10,000 than you normally would when you consider everything else. Okay? You are going to recap that money. I can just about guarantee you in your increased salary when you leave because you went through a residency and then you took your exam, you're going to recoup that very, very, very quickly. Okay, so students come out, and I was in the same boat. You're tired of school. You're, you don't want to. You just want to start paying down your student loans, and you just don't want that for another year. If you're interested in residency, right? If you're truly interested in it, I would strongly recommend that you consider it, research it, look into the programs, because you will get your money back. Because every year it's the same. That's one of the biggest reasons I don't want to take a cut and pay. Okay, you'll regain that. Once you get out, you're going to get paid more than what you normally would have started at, if that makes sense. Right? Because the employer wants you with them because they want to try to market you. All right. Joe, do you have anything you want to add to that? Like when you were like researching programs and looking at programs, what do you have any feedback with the salary and the feedback on how much other programs percentage-wise paid and tuition and stuff like that?
They were pretty much all the same in terms of that 70 to 80% of whatever the area was. And similar to what you said, Gary, all the other program directors I talked to, they pointed out the continuing ed stuff, and even going beyond when you're done with residencies, how they'll pay for you to take like the med bridge and the EIM courses, so that when you're done with residency, you still have tools to study for the board exams, and they pay for your exam. So I'd say they were all pretty much the same in terms of 70-80%.
All right, you totally went matrix on us, Joe. Yeah, your volume was really cool sounding. So, but thank you. So, exactly.
freeze?
So, yeah, you froze up pretty good. It was
Did
pretty.
you hear any of that?
It was pretty impressive. After the 70-80%, you kind of faded out. Yeah, but we're good. I think we got the gist of it. So there's a lot of other resources available,
In the world.
and each residency is gonna be a little different. Okay, so that's where I really want you guys, when you think about it, go do your homework, right? So if we're asking you what's stopping you from applying, what is stopping you from applying? Because we had some no's, we had unsure. I think we had one yes in the beginning. So what is your big thing? Is it fear? Is it you're just tired? Is it student loans? Is it money? Is it? Yeah, so I got some being away from family, and that's, yeah, and it depends again. If you mean being away from family, like relocating to a different state, or being away from family is you have to be gone during the night studying and doing other activities, research. Either way, you're away from family, whether you're a state away or you're just not there until 10 at night, right? So that is a real concern, right? That's why if you are thinking about residencies, and some of you may be married or not married, it's crucial that you discuss with your significant other your partner, your spouse, and be on the same page with it, because it is time consuming, right? Again, money and increased hours, unsure if it's exactly what I want to specialize in yet. So that's all good reasons, right? We just have to try to balance and decide, well, what's risk versus reward, kind of a balance in life. What do I want to do? Where do I want to get to? If you're a generalist physical therapist, like all programs, you get out of PT school, you're a generalist, right? You learn everything. And then you're just not sure where you want to specialize at. And that's okay. If you know you want to be in a certain area, right? A certain focus, orthopedic sports, geriatrics, you know that, pediatrics, then I would have to say that it's worth it. The balance, going into residency is worth it, because in the long run, quickly, within a year or two, especially 20 years down the road, it's going to pay off, right? And it's going to continue to place you in positions and put you with additional responsibilities where you work, to where promotion is going to be more possible, leadership is going to be more possible, and it just goes right down the line. Right? So, very good. Thank you for completing that. So the next step is basically, you know about the residencies, how many there are, what the different specializations there are, kind of what are some of the pros and cons. Other questions I usually get every year as well. What do you look for in an applicant? What do you, when you're interviewing or accepting people, what do you look for? And the big thing that UND looks for, we look for a lot of leadership. Okay, what are you doing within a university if you're in PT school, or your facility, and what are you doing outside in the community? Are you a leader? Do you have leadership experience? Do you have any additional certifications or licenses? Are you a member of the APTA? I had one gentleman apply, and for our sports residency, he was interviewing in February, and he became a sports resident in January. Okay, please don't do that. If you know you're going to be pediatrics or neuro or geriatrics, be it part of the section now, right? Do it early. It looks better than doing it the last month before you interview, right? It shows that you're passionate about it, that you've been thinking about it, that you really want to be in that specialty, because it's competitive. Okay? Most programs accept one resident. We accept one, some accept two. The big universities or big Ohio states might accept 3, right? So, but either way, it's competitive, and it's going to be more and more competitive. So build your resume and be passionate. For sports at UND, we look for clinical affiliations that you've been on regarding sports or orthopedics. Did you choose your elective in that area if you could? We look highly at your letters of recommendation. Please don't use your second cousin once removed Billy Bob as your reference, all right? So we like to see a faculty member that can speak on your academic. We like to see a clinician that can speak on your clinical abilities, right? So that all adds up. Usually you have to write an essay, but basically it comes down to it, do you have a passion for that specialty? When I interview people and look at their applications, can I read in their application that they're passionate about sports, that they want to learn more about sports and become a better clinician? Joe, I don't know if your Wi-Fi got fixed, but what are the attributes? That's my opinion, right? That's what we use at UND. Joe, what are your feelings and thoughts on that? Like, what do you think is important?
Are you able to hear me now?
Yep.
Is it better?
Yep.
Okay. Yeah, everything Gary touched on for sure. Even when I was interviewing the other people that I interviewed with, you can tell that they all were leaders in their school, whether it was they're part of the APTA or the sports section. They all had different certifications and licenses, and they were all extremely passionate about sports during PT school, whether it was volunteering with local teams, high schools, whatever. They all were going out of their way to show that they really wanted to work with athletics, because there's not a lot of jobs, particularly in sports and all these other areas where there are residencies, pediatrics, geriatrics. There's only so many specialization jobs, so you do have to do a little bit more to sort of stand out. But yeah, you really touched on Gary, I'd say.
So we're going to get to some questions, but my advice to you before we get to those questions is be proactive, right? If you choose to do residency, which I hope you do because it's very beneficial, be proactive. research the programs, ask questions, visit with the program directors, right? Call them, come visit. I just showed a gentleman around the other day who was doing a clinical nearby. So he came and we walked around the facilities and we talked and we met people. We want to do that. We want you to want to do that because it gives you a chance to meet us and we meet you. And it just adds to that. Is this going to be a fit or not? The worst possible thing is for you to be somewhere or for us to have somebody here that doesn't want to be here, that's not a good fit. That's a long 12 months for us and it's stressful. And so be proactive, do your research, ask questions to the program directors. When they say that you get to work with a certain team or work at a certain facility, ask them, well, how much work hands-on work do you get with that team? Or how many weeks do you work with that team? Get to know the program better so there's no surprises when you get there if you accept, all right? But visit with the program directors and visit with the former residents. When people call, I'm always like, do you want names and numbers of our former residents to talk to? Some programs will give you one name. You know, they might pick one that's just loved the experience and speaks really highly of the program. So I normally give a few names and emails that they can contact them, right? But do your homework, right? Ask questions, visit the program directors, visit with the residents when you're deciding in this, because again, it's a year out of your life. So I'm hoping you guys have questions, right? Usually I have to ask at least, you have to ask at least 2 questions before the presentation is over, but what kind of questions do you guys have for Joe or myself? Because Joe's valuable here because he's going through it right now. He just applied last year.
One question I have is, what are the pros or cons to going to residency right out of PT school, or going and working a couple years, getting some, more clinical experience and really figuring out what you are passionate about or what you like to do, and then going back to do a residency?
All right. Joe, do you want to answer that at all? You want me to take that?
So hopefully my Wi-Fi is still working. I can't tell.
Yep.
We still good, Gary?
Yep.
Okay. I know some classmates that I've talked to are like, I can't imagine going back to school or like learning or like taking less of a salary. So I know for some people it's kind of like a mindset in terms of once you go out and start to practice on your own, you don't have necessarily mentors or anything. They just are like, oh, I kind of like doing my own thing with no one. I don't know. That's what my classmates, at least, and they're like, I can't imagine taking less money or having to do more for that. So I know that'd be one con in that aspect, because I've had some classmates who are like, man, that your residency looks like a lot of fun, but that's where they look at it from. And I'm not sure, Gary, have you guys had a few residents who have practiced for a few years and then came back and done it, or a lot of them straight from PT school to residency?
The only resident we had, only one resident. She worked for maybe 9 months and she came to us. But the other flip side of that is you might go out and work in a clinic and have a better idea of where you want to go specialist-wise. But a lot of times when you go out after being a licensed PT, a lot of times you're going to work either in a hospital setting, you're going to work in some kind of acute neuro outpatient orthopedic, you're going to work in a certain setting, and you're not always going to have multiple every type of patient coming in unless you live in like a real low population or rural community. Then you might see peds, you might be a peds therapist, and you go to the nursing home and you do outpatient orthopedic, right? But in that time you learn stuff in PT school, and some of the things you guys learn in PT school, when you go out in the real world in the clinic, it's different, right? Not a bad different, it's just different. And sometimes when even in the clinic, we can develop bad habits sometimes, or we'll take a longer route to get somewhere. And so I think I like when PT students come out of school, go into residency, because they can try to remove those small mistakes that you make. We all make them, and I still make them, right? But you can try to remove some of those mistakes to make your outcomes better. You be a more efficient therapist. But there's nothing wrong with going out and working for a couple of years if you don't know for sure, right? But a lot of times you get settled in that area, right? And you start to develop friendships, and you start to develop relationships, and you go to this church and you have women's group or men's group, and you start doing this. All of a sudden now you get married, and now you have a child, and now you have this stuff, right? And it makes it that much more difficult to get back there. So not that you can't do it, It just makes it a little more difficult. And so if you're not certain which specialty, absolutely. I mean, don't just pick one and go. Go out and research it. And within your years, Rachel, in PT school here, you still have a couple years left, right? So as you keep going through and you get your other classes, you're going to probably be driven or pulled towards one area. So my thing is right now is if you're first year, second year, whatever, just be thinking about it and be open to it. And as you develop in your education, you'll be pulled to one area or the other. So great question.
I have a question.
Yep.
Have you had any residents do or go into professional sports, like working for a professional sports team?
Joe is our fifth, I want to say fifth resident. Two stayed and worked at the power center. And one of them is teaching at UJ, Jamestown. We have one that went back south in Atlanta, and she was working at a sports facility. We have, and she's just, I think, going to take a new job in Montana at this sports facility that is owned by a former NBA player. So she'll be working with a lot of athletes there. Yep. And then James went back south, and he was working in a sports clinic where he saw a lot of semi-professional athletes. His wife was a lawyer, and she stayed up here, so they were apart, South Carolina and Grand Forks, North Dakota for a year. So he actually came back. He's now working at Achieve, otherwise he was at a sports clinic treating a lot of athletes and has worked with semi-pro. Not many residents will go ahead and eventually work in professional sports, right? A lot of athletes will go and work at like the training house down by the cities, right? Or these sports facilities like Power Center. And less will be able to work with the professional sports. But the ones that do work with professional sports, a lot of times they go on for a fellowship. For example, a PT student went and did a residency and then went and did his upper extremity fellowship at Ohio State, and now he works with the Cleveland Indians organization. And so a lot of times you want to get, after residency, actually go and get a fellowship, which is now you really go to one area, the upper body overhead athlete, right? And so normally they do residency, then they do fellowship, and then that really increases their chances of a professional sport. If
When
that
you're
makes sense.
when you're talking about the fellowship, like, is that when they were doing their clinicals, like they were able to do work for that team in their clinicals, or what did you mean by fellowship?
So again, fellowship is when you're a licensed physical therapist. So you went to
Got it. Okay.
went to PT school, got a license, did a residency. Then a lot of times after the residency, you can do a fellowship on a side. It's almost like a subspecialty.
Okay.
So sports is a whole thing, upper extremity, subspecialty.
Okay.
Yep.
Thank you.
You bet. Great questions.
Okay, I have a question for Joe. Like, what type of leadership opportunities you and like accreditations going in, and like when did you know you really wanted to do the sports residency? What year?
So honestly, doing I kind of before PT school, like I knew I want to go into physical therapy, but I want to work with athletes. Just going through PT myself, it's like, okay, I want to work with this population. So I was, I guess, fortunate enough to have that mindset going into PT school. And I reached out to Gary probably my first year before PT school started, like, hey, I'm going to go to PT school out here. I want to come be out there. But during PT school, I coached junior college baseball at BSC, and then I was a GA 1 year at UMary. And so I was always around sports. And at UMary, I went and introduced myself to athletic trainers, like, hey, if you don't mind if I come down, just hang out in the AT room. So those are just some things that I did that helped me a lot. So coaching is a leadership thing. And then I helped out at Sanford Power. They had a baseball, and then they had a softball like academy that I helped coach those. And then for whatever reason, the guy who ran it quit, and they're like, hey, do you mind doing this? I'm like, sure, I'll do it. So those were just some things that I did in Bismarck, and that's sort of how it looked for me.
And yes, Alex, a new application cycle does not open until October 1st. So every year it's at October, they start opening. Yep. All right, I think we're past due unless there's another burning question that needs to be asked. No, but seriously, if you guys ever have any questions about any residency, right? Anything, right? You can email me. I'm at UND. Just look up my information, or Britta can get it to you. Go ahead and send me any message you want. I know other residency directors in other types of residencies as well, so I can point you in the right direction as well if you're interested. But I want to thank you. I want to thank Joe for hanging with us today. I want to thank Kaisa and all what you guys have done
Tried my
for this.
best.
Yeah, right. For the student conclave, you guys did a nice job organizing it. So thank you. And you guys have a blessed day. All right.
And then I threw my email in the group chat, so feel free to email me. I know my Wi-Fi wasn't the best. If you have any questions about the UND residency or any other residencies, because I have one buddy who's out in Utah. We have another girl who's doing a pediatric one in Omaha, and then one girl's doing a pediatric one down in Florida. And so they're all good people who'd be willing to answer any questions you guys have. So if you do, feel free to reach out.
All right, guys. Have a good day.
We'll see you.
Bye-bye.